号急救中心。他新冠多少天了？他有啥基础性疾病吗？
那我们第一时间车回来了会跟你联系的啊，电话保持畅通啊。
The phones keep ringing. With COVID infections soaring, calls to the Baoji Emergency Medical Center have tripled in the past 8 days, with as many as 840 in a 24-hour period. The number of elderly people with lung infections is increasing.
We've been told this patient is 91 years old. He has been infected with COVID and has had a slight fever for 10 days. He hasn't been able to eat anything recently.
Many elderly COVID patients have light symptoms at first, no high fever or breathing problems. But later, many are found to have low blood oxygen. Doctors call this silent hypoxia and say it's often a sign that symptoms are about to get more severe.
Here at the Emergency Medical Center, from medical workers to phone operators, all staff members have been working around the clock. This morning alone, from 8 a.m. to 12 p.m., the center has dispatched ambulances for over 40 times to pick up patients and send them to the nearest hospitals.
The Chinese Lunar New Year is approaching, and millions of journeys are already underway. That creates additional challenges for epidemic control, especially in rural areas. It means places like the Baoji Emergency Medical Center must make further preparations.
We will ensure that we deal with all calls. Normally, we have 2 to 3 phone lines in our center, but right now we have 13. As a command center, we will coordinate with 10 sub-branches in the city and 9 in counties. We've added more ambulances. The government has also called for experienced drivers to come forward in order to help.
Beijing says grassroots clinics like these are the first line of defense in health protection for rural areas, and early response is vital. The government says that each township clinic must have at least 1 ambulance and make sure that emergency calls can be received 24 hours a day, with vehicles can be dispatched swiftly. So far, over 98% of grassroots health institutions across China have opened specialist fever clinics. Wang Yue, CGTN, Baoji, Shanxi Province.